Hi, my name is Dr. Kenneth Carey. I'm an oral and maxillofacial surgeon. I'm an associate here at Sandhills Oral and Maxillofacial Surgery with Dr. Jones. I'm originally from Idaho. I went to school in Portland, Oregon at Oregon Health and Science, and I was trained in oral and maxillofacial surgery in the Army. I've since left the Army and have decided to call Fayetteville my home. I practice full scope oral and maxillofacial surgery, but the best part of my life is that I have 4 beautiful kids that remind me each and every day how precious life really is. When I was a kid, I was very accident prone, and I had numerous bicycle accidents, and I actually knocked out some teeth, and I got dental implants. From that point on, I was very interested in facial trauma because it was something that affected my life. And as I got to know the discipline more, it really just became something that I had a passion for. As any surgeon, I mean, you love to do surgery, but I think the thing that gives me the most joy is that when you can first meet a patient, get to know that patient, earn their trust, create a relationship that is enduring where patients can go out and they can say, look, my doctor, Dr. Carey, he truly cares about me and I trust him and I trust him with my family. That's ultimately what I want when I walk out the door each and every day. And that's a huge, huge blessing and wonderful thing in my sight because that is probably the most precious thing to me about being a surgeon. I mean, I love doing the surgery, but it's the patients that make this worth the while. Sometimes we can't get patients quite where they need to be when they have very complex procedures that they need to do. Maybe they have a tumor, or maybe they've had severe facial trauma, and we can never get them right back to where they need to be. But when we can walk that road with them and get them as close as we can, and they allow us to lead and guide them, then that's something that's very special. The surgeries are interesting, the patients are amazing, and then your colleagues and your staff. It makes it just a wonderful place to work and a discipline to work in. When I was young, I remember doing different jobs like haying or shoveling sawdust, things like that, and you would stare at the clock all day long. When I get here to work in the morning, I don't look at the clock until the afternoon. I realize, oh, I've got to go home now. I can't do any more surgery for the day because it's time to go. That's something special for me because I found something I love to do that I can actually earn a living at and help others with.